Hey, it's Pete. This is video number 2 in the series of my ACDR, so disc replacement at C5, C6. So today is the 7th of August. I'm just over 4 days post-surgery. Surgery went successful. So we replaced C5, C6 with an M6 disc. Placement by the surgeon was marked as a little bit further back than he wanted, but still the position was good. As you can see there below my beard, there's my kind of incision area somewhere here, I think it is. And then they give me quite a large dressing to keep the area free from infection and dry, basically. So I had mine done in North London at the Wellington Hospital. First night I spent in ICU. Which I was a bit fearful beforehand, but to be honest, they were absolutely fantastic nurses in there. So was very, very happy with the care I got in there. I did have some problems post surgery with the general anaesthetic. Did vomit after about 6 or 7 hours, which really put a lot of stress on the back of the neck. So I'm hoping this not caused any problems with the disc or anything like that. As a matter of course, we did take an X-ray the following day, so when I was, I can review that with the consultant kind of in 4 or 6 weeks, I guess. Aside from that, second day in hospital, they moved me to a standard ward, and it was just lots of painkillers, morphine, etc., paracetamol, that type of thing. I really wasn't in that much pain, so I didn't really use a lot of morphine. They had it on a pump machine where I could just click a button and request it when I needed it. I really didn't use a lot of it. I didn't need to. Just having paracetamol intravenously was fine with me. I wasn't in severe pain. What I did notice though is that my stomach was painful. When they do the surgery, they push the esophagus to the side and the windpipe. And what I noticed after is that I was really sore in the throat, difficult to swallow, like most people say. And my stomach was just full of lots of acid. I do suffer a bit from GERD, gastric reflux. So that's been more painful than the actual incision area itself. The pain I do have from the neck is at the back, so particularly I'll show you the back of there. That's, I think, C5, C6. That's the area where I do get the pain now. So yeah. In terms of primary symptoms, I notice I've just been for a walk, and when I do put my right foot down walking, I do feel like a shooting pain going down here, or going kind of down the right arm. So that's interesting. Hopefully that will settle within a week or so. I did see a physio at the hospital, I think on day 2 and day 3, and they did assess both the strength of my left arm and right arm, and the right arm was a fair bit weaker than the left arm, and historically that right arm was my stronger arm. So now it is day 4. I came home yesterday afternoon and just been sleeping a lot really. Tried not to take any painkillers today. Like to get off them as soon as I could. The only thing I did need to take was the antacid omeprazole, just because, I was just feeling stomach pain again. So as soon as I took that, it seemed to kill it. Slight headache on the right side. I think if you saw my first one, I was getting lots of headaches and migraines. So part of what I wanted to do this fall was to try and get rid of that. So I haven't had a migraine yet, but it is slightly painful, slightly headachy. It's definitely not happy yet. So we'll wait and see what happens. In terms of what the surgeon said, obviously he removed the disc here, and then there were 4 anatomies, both left and right, so to remove the bone spurs, which were causing the bilateral nerve pinch here. So that's all been done. So there shouldn't be any nerve compression now. I think it should just be healing. I do feel quite stretched and tight down the right side, and obviously my neck doesn't move very well yet. So I've only got very limited movement to the left and to the right. the physio says don't push it, so I'm not going to. They did give me a load of physio exercises, which were very sort of gentle, like head movements to the left. So 1, 2, 3, and to the right. 1, 2, 3, and then cervical nodding, so nodding down, stopping when you're getting any sort of resistance or pain. And I've progressed a little bit and started doing upwards. And this is where I get more of the resistance actually. And even doing that, I can feel kind of pressure down my right arm still. There we go. And then shoulder shrugs, push forwards, back. So I can do this full range of motion. It doesn't cause any pain. One of the things I did pre-surgery was a lot of physio and a lot of visits to the chiro. And indeed electroshock therapy to loosen everything up. So I'm probably not restricted too badly in that area because of all the effort I did pre-surgery. So there we are. Some of the things that I had that I was hoping might clear up, like tinnitus, haven't. That's still there. In fact, it might be louder than it normally is. I was noting it on the street walking, which I don't always do. So that hasn't cleared that up. So yeah, I think that's it for now. So we'll wait probably 4 or 5 days and see how I've progressed. And hopefully I'll be through the kind of sleeping phase and a bit more alert and with it. And by that time, I'll be ready to take off the bandage here, the dressing. And that is kind of restricting the head movement a little bit when I do the nods to the side. So I'm not really pushing through it. So at that point, it will be interesting to see what a range of motion I do have, particularly to the right side, because I had limited motion before. I had full motion to the left, but very limited motion to the right. So I'm hoping that will have cleared. Okay, so that's enough today. See you in 5 days or so. Bye.